Hello and welcome to Hanratty on Karate. So you probably all had this in your dojo. You have a young black belt or senior grade and they're a regular student, train regular, everything else, and all of a sudden you notice they're not there. This usually happens with teenagers. You ask around and find out they've got an injury. And it's usually an injury that's happened outside the dojo, I find anyway. Because we have very, very few injuries in the dojo, and we have a criteria and a procedure that we follow for any injuries that happen in the dojo. And it's usually from, I find anyway, that students miss class because of an injury that they've sustained either in school or playing another sport. More often baseball or basketball, occasionally football, but we don't tend to get too many of them. The football coaches are rather greedy and they demand that the kids only train in football, stuff like that. It's kind of like, a dojo that doesn't let the students train anywhere else. But I find football coaches are particularly, like this. They just don't want the kids training anything else. And yet they get more injuries in football than we ever get in karate. Now, the thing is, treating an injury, as I say, we follow a procedure and we have a criteria for determining the extent of the injury and the seriousness, strain, sprain, fracture, mild, moderate, severe, all that kind of stuff. And in our dojo, and certainly in my instructor's course, I always try to have my instructors prepare themselves for any injury that happens in the dojo. So they have an emergency game plan for dealing with these injuries. They know how to identify a sports injury, and they're also pretty sharp at when to get a student back in training. Basically, you know how to diagnose and treat soft tissue injuries, recognize the various types of sports injuries, and handle an emergency when it occurs. You're not going to run screaming and close the dojo down just because you see a bit of blood. Basically, the only injuries we get in our dojo are just like bruises, maybe a contusion, something like that. We very rarely get bone fractures. We might get a sprain or strain of some sort, and that's it. But mostly they're impact injuries, and it's usually impact by somebody mistiming a punch or a kick or something like that. But they're not very serious. Where you tend to get serious injuries, or what seriously affects your training, is when you get ligament injuries and tendon injuries. And these tend to happen more in sports like basketball and baseball and football. Like you get a lot of ligament injuries in basketball and baseball. If you're sliding into base, you're more likely to tear your ACL or your ICL. That's your anterior cruciate ligament that's kind of holds your knee in place and stops it going off in different directions. And tendons, which anchor the muscle to the bone. So ligaments basically hold your joints in place, and tendons are what anchor your muscles to the bone at different points. And I actually have tendon injury right now from my rotator cuff, which I'm trying to treat. And once you've determined the injury, where it happened and everything else, you try to provide a treatment plan. Now, what I found is you can provide a treatment plan, and in some cases, people will follow it. My theory is start moving as quick as you can after an injury. The first thing you want to do, just a mild injury, let's say you get an impact injury on the face, like a black eye or something like that, the most you're going to get. Then obviously you're just going to ice it and see if you can reduce the swelling or hematoma and, get back in. It's not going to cripple you or stop your training at all. But what I find is, and this is with people these days, and maybe they're right, but they tend to, especially the gentle parenting crowd, they over-exaggerate an injury. And you'll get kids disappearing from training for months on end because the parents are listening to medical advice, or they've maybe Googled it or something like that, and they want you to stop moving and not do anything. But this is a catch-all for injuries. A doctor will always tell you to stop moving and not do anything, because if you're not doing anything, you're not going to exacerbate the injury. And, of course, he's going to be right, okay? But at the same time, you're going to have to get back into your regular movements as quick as you can. Otherwise, you're going to lose muscle mass, and you're going to lose the flexibility that you've been so long developing. You'll probably lose your speed. Or I found, particularly in Kumite, people who get injured, when they come back, the timing's all gone. It's just all gone to pot. That's one thing, you're picking up your timing. You're going to drop your speed, and you're certainly going to lose some strength out of a muscle that's not being used, or out of a range of motion that you've restricted. You're going to lose that. So, from my point of view, get back to moving as quick as you can. So, with injuries, I'm going to just say that prevention takes priority in karate. And you're going to be more than likely have to deal with some minor sports-related injuries, but bear in mind that they're minor, unless there's any deformation of the bone, or if it's obviously dislocated or something like that, or there's a real major soft tissue like a torn cruciate ligament, or, whether it's anterior or interior, and groin pulls. You've got to be careful with them, which is what we get. And look out for head, neck, and back injuries. They're treated a little different than you treat injuries to your limbs. What I do is I follow a little criteria. I want to know straight away how it happened. I mean, sometimes you're just going to be sitting there and you'll see a kick go in, and you go, oof, I bet that hurt. Now, most people will shake it off, all right? But if it catches the solar plexus, then it's pretty bad. I know I've had kicks into the solar plexus and punches into the solar plexus by some really seriously strong people. And you probably think you're never going to breathe again, but after a few minutes, you are, okay? Is it from a punch? Which direction did the punch come from? If it can give your head a real snapping action, then you could have some minor concussion. If it was, across the head or to the back of the head, the occipital. Or was it from a fall? Okay, now, when I was coming up, we never had mats. They hadn't been invented then. So we did all our falls on hardwood floor, or whatever you were training on, sometimes just concrete with linoleum on it. But you learnt how to fall. Just the same in the street. If you ever take a fall in the street, you pretty soon learn how to roll or break fall or whatever. So you want to know also, was it a twisting action or a direct force, so an impact, or did something give way on you and got twisted out of place? What part's injured? You got to get to that straight away. Where does it hurt? And I always like to know what the student was doing when it happened, whether the attacker or the defender, and what the position was in. So just check for abnormalities, like if it's a little bit skewed, out of alignment, deformities, swelling, discoloration, any difficulty in them putting any weight on it, stuff like that. Other thing, listen, if it's making strange sounds like grating, it's probably indicative of a fracture. So these are the things that you go through, and then check for abnormalities, check for range of motion, especially if you suspect a fracture or dislocation. And if you do, don't try to treat it there, just immobilize it and get medical help. So you want to look at the stages of injuries, like there's certain injuries that are going to cause internal hemorrhaging or disruption or tearing of soft tissue, and that's associated with most sports. You're going to get small blood vessels bursting, which causes bruising, or you can get obvious blood loss, hemorrhage. So try to recognize all this by any discolorations and stuff like that. But on the other hand, as I said, what I tend to get these days, and it's a little bit disconcerting, is the soft parenting aspect, where people will stop the children, or offspring, if you like, because most of them are teenagers that I see, and protect them. And it's usually because the injury has happened in another sport. Now, as I say, I believe movement and keeping your range of motion, in other words, pushing your range of motion as far as you can, is better therapy than just sitting there with your leg wrapped up or in a sling or in a brace. Never seen too many braces when I was coming up through the ranks. Nowadays, people tend to rely on braces even if they haven't got an injury. And it may support the joint, but you're much better off building up the ligaments and tendons around that joint so that they can support it naturally and also you get a lot more strength through that joint when it's done naturally rather than relying on some neoprene sleeve or something to do that. So, yeah, injuries are a little bit different type of thing. And as I say, you find that most injuries occur outside the dojo. What I found in sports is basketball, baseball, whatever you're playing, football, they don't really tell you how to stay away from those injuries. Whereas in karate, we tend to emphasize the correct alignment of the joints and using full range of motion. And we probably use a lot more muscles in karate. I know my people, when they've done a class, we probably used every single muscle in the body. The other sports, baseball, basketball, all that stuff, you're going to rely a lot more on maybe cardio if you're doing basketball and football. Not so much baseball, they stand around most of the time. But that's just my opinion of baseball. A little bit aside. My opinion of baseball is it's like a sport built for failure, right? If you throw 1,000 balls and you only hit 300 out of the 1,000, you're something special because you have a 300 average, right? They don't mention the 700 that you miss. But anyway, just my opinion. The other thing is they'll encourage you to slide into base and, do all of this kind of stuff, which kind of encourages injuries, especially when you're not doing that much running, right? You're either stood out in the field waiting for a ball to come to you, or you're at bat or whatever. I don't think the percentage of actual movement in the game really encourages a safety aspect where you're sliding in with your ankles more than likely to go underneath you or your knees to fold. So, look at that. As for football, and when I say football, I'm talking about English football, not American football. You're obviously going to get injured in that. I don't care how much armour you wear. It's just armour and spandex isn't going to stop you getting injured when all you're doing is smashing into each other. But English football, you can get injured with ankles being deformed, knees being deformed, clashes against each other. Now, when you're doing karate, yeah, you're hitting each other, but you're not deliberately trying to smash the guy's knee out of joint. If you're in the street, you have the capability to do that, for sure. You have the capability to take people's knees out, and the techniques are in quite a lot of katas, how to do some serious damage to joints and, soft tissue, and even to practice doing really dangerous techniques around the head, strikes to the occipital, neck twisting, this kind of stuff. But we practice it, all right, so that you know what you're doing. It's not done accidentally now. Most injuries are accidental in sport. With probably the one activity, and I'm not going to call karate a sport because I've never practiced it as a sport, where we know we can injure, but we don't. We don't deliberately go out to injure, okay? And the thing is, and I tell my students, when you're not doing karate, you should be practicing karate. This is not something that happens, of course, because with soft parenting, they want them doing everything else. It's looked on as a recreational activity. To me, it's a way of life, not a recreational activity. So you're going to get your parents going, okay, you've got hockey on Monday, basketball on Tuesday, you can go to karate on Wednesday for an hour and a half maybe. Then on Thursday, you're playing this or something else. And so you only get some small sessions out of the week. That's not the way you're going to build up a karate philosophy or a karate lifestyle. Now, I'm not saying everybody wants to or everybody should. It's just the way I look at my karate. It's a lifestyle for me. It's a vehicle I've travelled on for the last 50-odd years, 56 years actually this year. This is what I do, I've been doing it for so long, it's second nature to me. Now, I've had injuries. Of course I've had injuries. I've had injuries both in the dojo and outside the dojo. Touch wood, I had quite a few street fights and confrontations, and luckily enough, never been seriously injured. I've had a knife slash, but it wasn't serious, I don't think so anyway. I mean, I still carried on fighting. I ended up taking the knife. But in the dojo, yeah, I've had strikes to the solar plexus that knocked me down, had split lips, nose jobs, and black eyes. At one point, I think I had a black eye for almost a year, continuous. they're not going to stop you. And if you're going to continue and you want to get anywhere, it's little things like that that build resilience. It's like the old saying, strength comes through adversity. So I want to get somewhere and you put a wall in front of me, I'm going to find a way over that wall, around it or under it. And that's the way I look at my karate. Whatever knocks you down or doesn't kill you, it makes you stronger, right? You build resilience so you always come back after an injury, right? You don't come back after 3 months because you've twisted your knee or something like that. You come back as quick as you can and you get your body back into the routine where you know you're going to stay fit. Taking 3 months off because of a twisted knee is never going to strengthen your knee, right? It's going to weaken it and weaken all the muscles around it as well. So you just got to get back into normal routine and normal range of motion as quick as you can, okay? So just watch your students, advise them on injuries and get cognizant with how the body works and what happens in certain types of injuries. You know, there's different kinds of strains, sprains, fractures. There's like 5 different sprains levels that you got to look at. Some are really severe, some are not. Muscle strain, yeah, we all strain our muscles when we go to the gym. That's what we're doing. Basically, you're straining your muscles so it'll build up and get past that point. It's like everything else. You got to keep working at it. You got to be resilient, fight your way through it. It's like when you're a baby, you didn't know how to walk. You look at babies, how often do they fall over trying to walk, right? That's the way it is. You get back up and you start walking again. It's the old saying, get knocked down 7, get up 8. Okay? That's what karate is all about. That's the mindset it should give you. Your body will do what your mind tells it to do. Unfortunately, people's minds don't tell them to do half as much. They rely on social media or a soft parent to advise them on things. Just try to feel your own body. You know what's best for you. Everybody is different, right? Maybe you can stand up without falling over. Work around it. Work at it. You will, all right? Maybe you can't kick Jordan. Keep working at it. One day you will, okay? I knew a guy, and this was one of my old instructors, not going to say his name, but he always wanted to do full splits. Now, I always wanted to do full splits, and I worked on it, and I got really, really close. I'm nowhere near it now, but I got really close. But this guy did it all the time. I even put like 2 pieces of paper, one under each foot, and spread himself out. Or in the dojo, he put 2 pieces of cloths so his feet would slip apart. And he could never do it. But he was teaching on his 70th birthday, and he went into full splits. Something to think about, okay? Just fight your way through adversity. Always keep pushing. Only listen to yourself. Listen to your inner voice. Your inner voice might tell you that karate isn't for you. Fine. Listen to it and don't train. Go do something else. But most people, when you get up around Shodan, Nidan, Sandan, it's probably what they should be doing for the whole life, because it's going to improve your mind so much. It's going to improve your body so much, okay? It's going to give you so much self-confidence and self-satisfaction that because of what you do, and because you do it through all the adversity, you're always going to be resilient. It teaches you this. And you can apply that to any aspect of life that you want. You can apply this resilience and this strength that you built up and this confidence. You can apply that to any aspect of your life. But if you never feel that, if you never get that, if you're not used to pushing through adversity, then you're not going to do it in any aspect of your life, okay? So take advantage of what karate teaches you besides the basic techniques and the fitness level and the strength of mind. Take advantage of all these things and use them in everyday life. But don't pack in just because you get an owie, okay? There's a big difference between an owie and an injury. Learn to know the difference and be independent enough to find your own cures, find your own way around it, all right? Anyway, as always, just my opinion. If you want to give me yours, let me know.